9 popular medications that can trigger rapid dementia. It's a startling fact that every 66 seconds, another senior in this country receives a diagnosis of dementia. By the time this video concludes, an additional 20 families will have heard those life-altering words. For some of them, the reason for this decline won't be simply advancing age. Instead, it could be a bottle sitting innocently on their bathroom shelf, a product they were assured was completely safe. My name is Dr. John Myers, and after 15 years in practice, I've witnessed this exact scenario unfold far too many times. I've seen individuals who were sharp and vibrant their entire lives begin to falter, losing the thread of conversations, forgetting appointments, and even struggling with familiar drives they've made countless times. Yet, those around them often dismiss it as a normal part of aging. The reality, however, is that it wasn't age at all. It was a medication. A medication that hardly anyone questions because it was prescribed by a doctor and dispensed by a pharmacy. What newer research consistently reveals is quite concerning. A common class of everyday drugs can significantly impair memory and learning capabilities within a single year. Tragically, most individuals taking these medications have no idea this is happening to them. Today, I want to guide you through 9 specific medications that are most strongly linked to rapid memory loss. We'll count them down, starting with those that are often quietly overlooked and ending with what I consider to be the most damaging of all. Pay close attention to number 3. It's a drug given to millions of seniors for conditions that sound entirely harmless, yet it might be silently shrinking the memory centers of your brain right now without a single warning sign. Before we begin, please share in the comments how old you are and which medications you take daily. I read every single comment, and understanding the age of my audience helps me tailor the information I provide. Let's start at number 9. And don't let its low position on the list fool you, because this medication is likely present in almost every medicine cabinet across America. Number 9, diphenhydramine. You'll likely recognize this by its common drugstore name, Benadryl. It's that little pink pill people often reach for when they can't sleep to soothe an allergic reaction or to ease the symptoms of a cold. It's inexpensive, readily available on open shelves, and most people assume that because no prescription is needed, it must be gentle. However, inside your brain, it's doing something quite different. Benadryl belongs to a group of drugs called anticholinergics. While that sounds like a complex term, the idea is quite simple. They block a crucial brain chemical known as acetylcholine. Acetylcholine is like a messenger in your brain, essential for forming new memories and for maintaining alertness throughout the day. As we age, our brains naturally produce less of it, making us more reliant on the acetylcholine we do have. Therefore, a drug that blocks this vital chemical will have a much more significant impact on a 70-year-old brain than on a 30-year-old one. The area of the brain that takes the brunt of this blockage is the hippocampus. This small, seahorse-shaped structure is where new memories are initially formed before being stored away for later retrieval. In my practice, I've seen many patients take a nightly antihistamine for years, gradually losing their sharpness. They never once connect this mental fog to the pink pill sitting by their bedside. Scientific research firmly links these drugs to cognitive decline. A study published in the Journal of Geriatric Cognitive Health in 2023 followed older adults who regularly used anticholinergic drugs. It found a staggering 54% higher risk of developing dementia compared to those who avoided them. That's more than half again the normal risk, stemming from something most of us treat like candy. Here's what you can do. Carefully read the labels of anything you take for sleep. Any product marked PM, nighttime, or allergy relief. These often contain diphenhydramine under a different brand name. If you're taking it for allergies, consider newer antihistamines like loratadine, Claritin. These drugs don't cross into the brain as readily as Benadryl does, making them a much safer choice for long-term use. Crucially, never stop taking a medication on your own. Always discuss any concerns with your doctor. But please, stop assuming that over-the-counter automatically equates to safe for your memory. That concludes number 9. Number 8, proton pump inhibitors, PPIs. Next up is a medication that your stomach might love, but your brain quietly pays a price for. Number 8 are the proton pump inhibitors. Well-known brand names include omeprazole, Prilosec, and esomeprazole, Nexium. These drugs work by suppressing acid production in the stomach. They are commonly prescribed for heartburn, acid reflux, and that burning sensation after meals. People often stay on them for years, sometimes even decades, because the moment they stop, their symptoms return with a vengeance, making it feel as though the medication is the only thing providing relief. Here's a crucial point that many people miss at the pharmacy counter. Your stomach needs acid to properly break down certain nutrients from your food. One of the most important of these is vitamin B12, which is vital for protecting the intricate wiring of your nerves in your brain. When you suppress stomach acid too much for too long, your B12 levels can quietly drop. Similarly, magnesium and calcium levels can also decrease. These are two minerals that your brain cells absolutely depend on to function correctly and transmit signals clearly. When neurons are starved of these essential nutrients, you can experience misfires, confusion, and memory lapses that look eerily like early Alzheimer's. The true culprit, however, is a nutrient deficiency caused by a medication you've been taking all along. A significant study published in JAMA Neurology in 2016 examined over 73,000 individuals aged 75 and older. It found that regular PPI users had a 44% higher risk of developing dementia compared to those who didn't take these medications. The problem may even run deeper, as PPIs have also been shown to increase levels of amyloid beta in the brain, the sticky protein that accumulates in Alzheimer's disease. So, here's what to do. If you are taking a PPI every single day, this is a critical conversation to have with your doctor. Many individuals can successfully taper down to a gentler class of medication called H2 blockers, such as famotidine or Pepcid. These are far less likely to impact your cognitive function. Additionally, chewing deglycyrrhizated licorice, a natural compound that coats and soothes the stomach lining, can help manage symptoms without any detriment to your brain. The goal should always be the lowest effective dose for the shortest necessary duration, not a pill you take indefinitely out of habit. Number 7, bladder medications. Number 7 is prescribed for a problem that many people would prefer not to discuss. These are bladder medications, and one to be particularly aware of is oxybutynin, sold as Ditropan. This medication is often given to seniors who experience a sudden, urgent need to use the bathroom, the kind of overactive bladder that can significantly disrupt their daily lives. The relief it provides is real, and it spares individuals from considerable embarrassment. However, oxybutynin works by blocking acetylcholine, the very same memory-supporting chemical that Benadryl interferes with. And importantly, this drug crosses into the brain quite easily, lodging itself precisely in the areas where memories are formed. This makes it one of the more concerning medications on this list for older adults, especially when taken consistently over months and years. In 2019, the British Medical Journal published a study involving individuals over 65 who had taken strong anticholinergic drugs like oxybutynin for over a year. Their risk of developing dementia was a remarkable 49% higher, nearly 1 in 2. What troubles me most is that almost none of these individuals were warned about this potential side effect. They were told a pill would help their bladder, but no mention was made of it potentially dimming their mind simultaneously. The resulting mental fog is often attributed to age. People start forgetting appointments, misplacing keys multiple times a day, or losing the thread of simple conversations. Everyone around them nods and says, "Well, you're getting older." It's rarely traced back to the prescription until significant cognitive ground has already been lost. If you are taking oxybutynin and have noticed your memory beginning to slip, please take this very seriously. You shouldn't have to choose between a healthy bladder and a healthy brain. Newer medications like mirabegron work through entirely different pathways and do not block acetylcholine at all. For most older adults, these offer comparable bladder control with significantly less risk to their cognitive function. Bring this up at your next doctor's visit. Number 6, statins. Number 6 might be the most surprising medication on this list because it's one of the most widely prescribed drugs globally. We're talking about statins. Simvastatin, Zocor, and atorvastatin, Lipitor, are among the most frequently prescribed medications worldwide, especially for individuals over 60. They play a crucial role in lowering cholesterol and reducing the risk of heart attacks and strokes. For many people, statins are indeed a necessary part of their health regimen, and this discussion is not meant as an outright condemnation of them. However, there's a crucial half of the story that often gets left out. Cholesterol does much more than just affect your heart health. Your brain is composed of nearly 60% fat, and it relies on cholesterol to build the myelin sheath, the protective insulation that wraps around every nerve fiber, allowing signals to travel quickly and efficiently. When you lower cholesterol too aggressively with a potent statin, you can inadvertently leave your brain short of a vital building material it actually needs. The statins that tend to cause the most cognitive issues are those that readily cross into brain tissue. A 2023 study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. And importantly, the higher the dose, the more pronounced this decline. Some patients described frightening memory gaps, forgetting familiar names, having recent conversations completely erased from their minds, or suddenly not recognizing routes they had driven for 2 decades. It's important to understand that not all statins affect the brain in the same way. Pravastatin and rosuvastatin, for instance, do not cross into brain tissue as easily and are generally considered safer for cognitive function. So if you've been taking a statin for years and are noticing increased brain fog, forgetfulness, or confusion, this is a very important conversation to have with your doctor. It might involve discussing a lower dose or switching to a different type of statin. This is not a reason to stop taking a medication that may be protecting your heart without medical guidance. Work with your doctor to find the right plan. Number 5, benzodiazepines. Before we continue the countdown, a quick pause. If this information is resonating with you and connecting the dots, please take just 1 second to tap the like button. It genuinely helps this video reach more seniors who need to hear this vital information. And while you're there, please tell me how many prescriptions you are currently taking. I read every comment. All right, back to the countdown. Number 5 are the benzodiazepines. Medications like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are among the most frequently prescribed drugs in America for anxiety and sleep disorders. They work by enhancing GABA, a brain chemical that acts as a calming signal, effectively turning down an overstimulated nervous system. Initially, they can feel like a lifesaver, bringing relief from panic, quieting racing thoughts, and finally allowing sleep to come. However, over time, the picture changes significantly. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting versions, like diazepam, were found to be particularly concerning because they linger in the body and can accumulate in fatty tissues, including the brain. What these drugs are essentially doing is a slow chemical sedation of the entire brain. It becomes less adept at learning new things and less flexible. Many people describe a feeling of flatness, a sense of moving through a fog, and no longer feeling quite like themselves. The most unfortunate aspect is the withdrawal process. If you stop a benzodiazepine abruptly, the anxiety and insomnia can return with twice the intensity, accompanied by agitation that can be genuinely dangerous. This can make the pill feel absolutely essential, precisely when it is causing the most harm. Therefore, this rule is critical. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly. Doing so can be life-threatening. Work closely with your doctor to slowly taper down your dosage over weeks or even months. Safer alternatives exist for anxiety, such as buspirone, which doesn't cause sedation or mental clouding. For sleep issues, there are forms of talk therapy specifically designed for insomnia and anxiety that can restore calm without the cognitive cost. Number 4, amitriptyline. Number 4 is a single pill prescribed for 3 different conditions, and it carries one of the heaviest hidden burdens of all. This is amitriptyline, sold under the brand name Elavil. It's an older antidepressant that is still prescribed today for nerve pain, for sleep issues, and even to prevent migraines. Its versatility is precisely why it is spread so quietly through the population, appearing to be a do-it-all medication. However, beneath its surface utility lies one of the most potent anticholinergic drugs still in widespread use. This means it powerfully blocks acetylcholine, the very chemical your neurons need to communicate with each other and to solidify new memories. It blocks this crucial chemical so effectively that with long-term use, its impact on memory stops being an occasional side effect and becomes the expected outcome. In 2015, a large study in JAMA Internal Medicine followed over 3,400 adults aged 65 and older. Those with the highest cumulative dose of anticholinergic drugs like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. And again, almost none of them were ever informed that the pill could have this effect. They received it for sleep or pain and then slowly noticed words disappearing, memory thinning, and concentration fraying, attributing it all to age. It doesn't even require a high dose. A small nightly dose taken for years can quietly erode brain power without any obvious symptoms until the memory loss is significant. If you or someone you love is taking amitriptyline, this is a conversation worth having with your doctor very soon. For nerve pain, alternatives like duloxetine or gabapentin can offer similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is much gentler on this particular brain chemical, can be used instead. And for mood support, newer antidepressants like sertraline or escitalopram are considered much safer for the long-term health of the brain. Number 3, paroxetine, Paxil. Number 3 is the one I specifically told you to watch for because it's given to millions of people for something that sounds entirely harmless. This is paroxetine, sold as Paxil. It's one of the most commonly prescribed medications within a class of antidepressants known as SSRIs, used to treat depression and anxiety. On the surface, it appears to be a more modern, gentler option compared to older psychiatric medications. Here's the crucial detail that is rarely mentioned. Paroxetine is the only SSRI with significant anticholinergic activity. This single fact sets it apart from its counterparts like sertraline and escitalopram, as it directly impacts the same acetylcholine system that all the other drugs on this list have been chipping away at. In 2021, a comprehensive review in Frontiers in Psychiatry examined older adults taking different SSRIs. It found that users of paroxetine experienced measurable declines in short-term memory, word recall, and attention within the first 12 months of use. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. There's a profound irony here, as the drug is prescribed to stabilize the mind, yet over time it can actually erode the very clarity it was meant to protect. The solution here is quite clear. In older adults, paroxetine is a medication to avoid. The American Geriatric Society has formally placed it on the Beers list, a recognized catalog of medications considered risky for seniors, and paroxetine is included for precisely these cognitive reasons. If you are taking it, ask your doctor about switching to a safer SSRI like sertraline or escitalopram, which are gentler and do not carry the same cognitive risks. Supporting your B vitamins, particularly B12 and B6, can also help naturally stabilize mood alongside such a medication change. Number 2, antipsychotics. Number 2 is so quietly prescribed that many individuals taking it have no idea what class of drug it even is. These are the antipsychotics, and this one deeply disturbs me because so many people taking them never actually agreed to take an antipsychotic in the first place. Common names include quetiapine, Seroquel, risperidone, Risperidol, and olanzapine, Zyprexa. These medications were initially developed and approved for serious psychiatric conditions like schizophrenia and bipolar disorder. However, today they are frequently prescribed off-label to older adults for sleep, mild restlessness, or the agitation that can accompany dementia itself. Powerful drugs intended for severe mental illness are now being used in homes and nursing facilities on seniors who are simply confused, restless, or difficult for busy staff to manage. The cost of this practice is steep. In 2022, a study in Lancet Healthy Longevity followed over 25,000 older adults. It found that those given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even if they had no prior history of dementia. These same drugs also increase the risk of stroke, sudden cardiac death, and the heavy sedation that leads to falls and subsequent hospitalizations. They work by suppressing dopamine, a chemical not only tied to mood, but also crucial for focus, planning, and memory. When dopamine levels are significantly dropped, the brain becomes slow and unresponsive. This is why individuals on these medications can appear dulled, flat, and almost absent, while their families grieve for the person they know is still physically present before them. If you or a loved one is taking one of these medications, the very first step is to ask the prescribing doctor a direct question. Why was this started? And is it truly necessary? Or is it being used for convenience? Most behavioral symptoms can be managed effectively without medication through consistent daily routines, reducing environmental noise and overstimulation, addressing hidden pain, and optimizing light and sleep patterns. When medication is truly needed, using the lowest dose for the shortest duration will minimize harm. Far too often, families are not informed about the potential effects these drugs have on the brain, and they witness a decline they believe is simply aging, when in reality, the cause is chemical. Number 1, anticholinergic polypharmacy. Number 1 isn't a single drug at all, and it may be the most significant hidden driver behind every story I've just shared with you. This is anticholinergic polypharmacy. It's the danger that almost no one names, and it's likely one of the leading causes of drug-induced memory loss in older adults. You are probably expecting me to reveal one final, singular villain pill. However, the truly worst-case scenario is something far more subtle: the cumulative effect of taking several anticholinergic drugs simultaneously without anyone adding up the total burden. Polypharmacy simply means taking many medications at once. The anticholinergic burden refers to the combined impact of all these medications blocking that single crucial memory chemical together. Picture a very common situation. A senior takes Benadryl every night for sleep, oxybutynin every day for bladder control, and amitriptyline for nerve pain. Individually, each of these might cause only a small, barely noticeable dip in cognitive function. But when taken together, they compound each other, and the total burden on the brain climbs rapidly. In 2022, a study in Age and Aging tracked over 280,000 older adults. It found that those with the highest anticholinergic burden had a staggering 120% higher risk of developing dementia within 10 years, more than double the normal risk. And the vast majority of these individuals had no idea they were even taking anticholinergic drugs. No one had ever explained it to them. When acetylcholine is blocked from multiple directions simultaneously, the brain doesn't just idle. Neurons begin to wither from disuse, connections shrink, and the brain settles into a quiet, underpowered state that, on testing, looks almost identical to Alzheimer's disease. Here's the hopeful part, and it's precisely why I made this video. Drug-induced cognitive decline is often reversible when caught early. When you lift the burden, many people regain their clarity, their energy, and their memory within weeks or months. The brain is far more resilient than we often give it credit for, but only if you remove what is actively harming it. The fix doesn't require a miracle. It requires a thorough medication review. Sit down with your doctor or pharmacist and have them go through every single prescription, every over-the-counter pill, and every supplement you take, and calculate the total anticholinergic load. Simple scoring tools exist that can do exactly this. Once the problematic drugs are identified, you can taper off those you don't need, switch to safer alternatives, and give your brain the room it needs to recover. This is the most preventable threat to the aging mind on this entire list, and that's precisely why it sits at number 1. Now I want to hear from you. Of these medications, which ones are currently in your medicine cabinet? Have you noticed brain fog or forgetfulness creeping in after starting something new? Please share your experiences in the comments below and tell me that you will ask for a medication review this week. Your answer might be the very thing that helps save the next person who reads it. And before you go, there's one more place your body hides its warnings. Your medicine cabinet is one, but your hands are another. Your fingernails can actually flag trouble in your kidneys, your blood, and even your nervous system years before any other signs appear. And most people never know what to look for. That's the topic of my next video. I'll be showing you 4 key nail signs that are worth checking tonight. I'm Dr. John Myers. Stay sharp, and I'll see you there.